Well, good morning, everyone, and welcome to our discussion session called Collecting the Pandemic. This is actually a combined session of two different presentations, the first being the private lives of donors, issues encountered in building a collection on the fly. And then we'll roll into collecting archival materials during the pandemic. Where are we now? My name is Lynn Livingston. I'm a member of the Local Arrangements Committee, and I will be your moderator this morning. Before we get started, just a few housekeeping items to cover that you've probably heard a couple times already. We'll utilize Zoom chat for any questions. So as they come to mind, please feel free to pop them in there, and we will get to them with about 15 minutes left in the session. Please feel free to chat me directly if you have any issues, if you're experiencing any trouble. My video may be off, but I am certainly here. And now I would like to introduce Laura Jackson with the University of Northern Colorado. And so take it away, Laura. Thanks so much.
Okay, great. Thank you so much, Lynn. Hi, everybody. I'm Laura Jackson. I'm the Archives and Special Collections Librarian at the University of Northern Colorado. My colleague Jane Munson and I worked on this presentation together. Unfortunately, Jane could not be here, so I'm going to present her parts. And I do want to let everybody know that this presentation almost didn't happen. I also had an emergency. And I was wanting to work on this a little bit more yesterday. I just want to ask you for your patience and your kindness in case you're like, wait a minute, this is not the greatest presentation I've ever seen in my life. But yeah, we're gonna get through it, and I'm happy to be here, and I'm happy for the distraction. So let's get to it. So this presentation is about the efforts to acquire materials documenting the pandemic at the University of Northern Colorado. So I'll give you a brief background about the project itself, including our current workflow for acquiring and accessioning born digital materials. And then I'll discuss one of the more interesting aspects that we sort of had in our situation, which was going straight from acquisition to access and skipping the usual collections management steps of accessioning and processing. And I'll also tell you about the privacy issue that we encountered, which potentially happened because we kind of went with the flow and skipped some of these steps, although that's debatable. And then I'll end with lessons learned. And I'll be posing some questions to you, the audience, throughout, just to keep you engaged. Please answer in the chat. And with that, I will ask my first question, which is how many of you have implemented or worked on coronavirus collecting efforts? And you can answer yes or no. A longer explanation if necessary. So I'm saying yes, yes, yes. Lots of people. No, there's one no. Oh, hey, Dylan. Yeah. So yeah, most of you have. Okay, excellent. Thank you. So maybe you can relate to some of these issues that we encountered. All right, so the University of Northern Colorado, we are a medium-sized doctoral research institution. We have about 11,000 students. And then the James Michener Library, which is where Jane and I work, that houses the Archives and Special Collections Department. Our digitized and born digital materials from the archives are made accessible in the digital repository platform, which we call Digital UNC, and it's an Islandora repository. So as you all know, March 2020, COVID pandemic caused the campus to shut down and everything went online. And so in an effort to document the effects of the pandemic on the UNC community, the Archives and Special Collections launched the Coronavirus at UNC Archive Your Story project. And really the goal was to capture the personal stories of students, faculty, staff, administrators, alumni, and community members, and create a collection that would reflect the day-to-day social and emotional experiences of UNC community members living through the pandemic. We really wanted to capture these personal experiences, probably like a lot of your repositories, we did not have a lot of, we don't have any personal experiences documenting the 1918 flu pandemic. And we have very little documentation about that pandemic in general. So we really we knew that historians and people were going to be interested in, what life was like. So we launched a publicity campaign to solicit materials, and we utilized social media and university email lists to get the word out. We directed readers to a LibGuide outlining the project, and community members were asked to submit journal entries or other personal accounts, either written or recorded in audio or video form, as well as creative work such as paintings, poetry, and photographs. A series of prompts were provided to encourage participants to reflect on topics like transitioning to online work or classes, adjusting to the new normal of pandemic life, and just their thoughts on the university's response to the crisis. Submissions were collected via email or uploaded directly to a folder via Microsoft OneDrive. Participants were asked to submit a standard gift agreement and grant permission for donated materials to be shared with the public in the digital repository. We also gave people an option to do an oral history interview with an archives staff member. So when we started acquiring materials, which were all born digital, we did not have a written or standardized workflow for acquiring, accessioning, or processing born digital materials. Now, this isn't to say that we have never acquired born digital materials before. We have, but in a haphazard, totally non-standardized, and somewhat inaccessible manner. So basically, when born digital materials came in, the process differed depending on who was working with the files and what those files were. The one consistent practice, though, was to not formally accession or document these born digital acquisitions. So, for example, for years, we've received the minutes of the Board of Trustees meetings via email. They send a PDF to an archive staff member, and as soon as they're received, they're uploaded to Digital UNC, which is great for access, but the acquisition is not documented anywhere, so it's not so great for collections management. We have started to create a standardized accessioning workflow, but our big issue is that we don't have designated preservation storage for born digital materials. So somewhat with shame, currently any born digital material that is received and makes its way to me is saved in a shared folder in my OneDrive account. The good news, I know that's awful, but the good news is that this material is being formally accessioned and documented in our collections management system, which is ArchiveSpace. So as you can tell, we were not in the best position to launch an effort that would likely be all born digital collection materials, but we did it anyway. And we didn't have a huge influx of stuff, but by the end of spring semester 2020, we had acquired 6 oral histories, university emails, class assignments that somehow related to the pandemic. We had this staff member donated this fabulous comic strip, which you can see one of the drawings on the screen. And we got photographs and then some personal written accounts. And so all in all, we received about 10 gigabytes or 300 files by the end of the spring semester last year. And we really adopted this go with the flow attitude to collecting this material. This sense of figure it out as we go has, from my perspective, permeated the archives, my archival repository for a long time. And when I started working at UNC 3 years ago, it's something that I really resisted. But last May, when we did this, I embraced it wholeheartedly for reasons that I'll explain in the next slide. So material came in, I didn't accession the materials as they came in. I did retroactively accession the material a few months later. And then any and all administrative documentation or emails about the acquisitions and gift agreements, which we did get gift agreements for everything, those were all saved alongside the collection content. And I also had an intern in the spring of 2020 who was able to help launch this project. Her name is Aubrey Van Oss, and she did create a minimal finding aid in archive space. So at least the collection was, somewhat discoverable alongside all of our other finding aids. But really the materials went from my OneDrive account to Digital UNC without being formally accessioned. And so my colleague Jane and a tech services staff member worked on the metadata and uploading those materials to Digital UNC. And it really made this material accessible online much faster than anything we've really done before. So why did we choose to do this? Why did we choose to go with the flow and go straight to access? Well, I really felt a sense of urgency, and I kind of leaned into the pandemic attitude of just doing whatever it took to get through, to get through the day, or in this case, a collecting project. And by prioritizing access, the materials became accessible a lot more quickly than if we had prioritized our standard collections management practices. Really, our goal is access, and I didn't want this material to linger in my OneDrive for months and years. I kind of just wanted to make it accessible right away. If I had accessioned the material and processed it prior to serving it up online, I would have had to first figure out how to do that. And I would have wanted to create full workflows for those processes. And that just seemed daunting, and it seemed like it would just delay access, especially because we have no dedicated storage for this stuff. And like most universities at the time, the budget situation was seeming more dire by the day. There was talk about layoffs, and I was really worried about losing my job, and I really wanted to show my value and the importance that the archives can have. So having this material readily available was one way to demonstrate this. Now, of course, there's a lot of reasons why maybe we shouldn't have gone with the flow. The biggest reason that I can think of is that this process left us with little physical and intellectual control over the material. It kind of went against everything that I've learned in the last 14 years. I'm a big believer in doing the intellectual work to properly manage materials before serving them online to the public. And by not accessioning nor processing, nobody had worked closely with this stuff, which meant there was an increased risk of privacy violations, which I'll touch on a lot more in the next slides. Also, the materials were not quite in their final state before they went online. So we did transcripts for the oral histories, and some of those were not finalized. We basically created the transcripts by running them through a speech to text online, some free online software. And they were kind of, and we didn't clean them up essentially. And those are online. And sometimes the transcripts just don't exist. There was also no archival metadata to draw from, which isn't necessarily a problem, but I feel like it might lead to problems down the road if, for example, we have two different titles for the same thing. It's going to be it's going to be difficult to determine, what's online. Is this thing really online, or is it different? So there could be issues there. So now I want to take a moment to ask you all a question that might seem a bit controversial, but I am curious to see what you think. And that is, can traditional collections management practices like accessioning and processing actually hinder, delay, or complicate access? What are your thoughts? I'll give you a minute to respond. Certainly. Yeah. Depends. Totally depends. Mm-hmm. Yeah. Yes. MPLP not always the best solution. Yeah, I agree, but it hurts my heart to agree with that. The MPLP, not only the best solution. Yes. Okay. Thank you. People might still be typing, but I thank you for responding to that. All right, so I'll switch gears a little bit and talk about, oh wait, there's a couple more I just want to see. Also struggling with MPLP with digital collections online. Okay, good, glad we're not the only ones. Yes, but it is always in the best interest in providing access to collections. Yeah. Oh, hi, Ruth. I think it also depends on time frame. Skipping steps in the beginning might provide more access in the short term, but puts more burden on the long term. Yeah, you skipped right to my lessons learned at the end there. Okay. So in addition to going straight to access, or possibly because we went straight to access, we found ourselves with this third-party privacy issue. So we had a donor who was a very eager to contribute grad student, and she participated in an oral history. And she also deposited a lot of photos in the OneDrive folder, and she's still uploading folders to this day, and she wants to do a follow-up oral history, and it's wonderful that she's so into this. But during the donation process, the donor had specified in the gift agreement that she wanted all names to be redacted from journal entries prior to access. And I said that, you know, we really, like, it's fine if you want to put that in the gift agreement, but we're not going to be able to redact names. We just don't have the staffing to work on materials at that level. So we would probably return the material, because we also wouldn't want to restrict, we wouldn't want to have it like, you know, things indefinitely restricted because there were names in them. So I recommended that she remove the names from anything she gave us, just so that we could actually make the materials accessible more quickly. And so for the oral history, I sent the questions to her in advance. And after the oral history, she told me that she had actually typed out all of the answers beforehand and asked if we wanted that document. And she said that it contained more details and more information than what she said in the oral history. So I said, yeah, you know, we'd love to have that document. And it was kind of like almost like diary entries. It was very long, and there were a lot of details in it. So she uploaded that document to the OneDrive folder. So when Jane was putting all this stuff in Digital UNC, she was just reviewing the content beforehand, before she uploaded it. And she noticed that the written answers included very personal information about her boyfriend cheating on her. So Jane writes, as I was uploading the files for this oral history to Digital UNC, I skimmed the document that contained the typed answers from the donor. It was similar to, but more detailed than, the video transcript file. So I was comparing the two and trying to figure out whether both documents needed to be uploaded. That's when I noticed there were personal details about the donor's boyfriend, his occupation, where he lived, etc. And his relationship with another woman gave me pause. Since the donation included a set of photos that featured partial images of the boyfriend, some masked, some from behind or the side, etc., and the inside of his apartment, I had concerns about making all this information publicly available in the repository. I thought it wouldn't be hard to use the written document and the photos to identify the boyfriend, and a look at the donor's Facebook profile, which is publicly accessible, confirmed this. And this could potentially be an invasion of his privacy. It seemed somewhat inappropriate to air the details of this couple's relationship issues in the context of a library repository. They were irrelevant to the overall collection, and we didn't know whether the boyfriend would consent to it, end quote. So Jane then brought this issue to me, and we started talking about it, and we realized that we had opposite perspectives about what to do with this material. So first I'll share Jane's perspective. So Jane wanted to restrict the material, and her reasoning was that it was just too recent history, right? It's not something from the past. This affair happened, you know, months, days before this, before the pandemic. And it could potentially be defamation. It might bring about a lawsuit. It could potentially cause harm if the boyfriend discovered it online and then complained to the university. Also, an argument can be made that the SAA Code of Ethics favors restriction. So the Code of Ethics states that archivists establish procedures and policies to protect the interests of donors, individuals, groups, and organizations whose public and private lives and activities are documented in archival holdings. As appropriate and mandated by law, archivists place access restrictions on collections to ensure that privacy and confidentiality are maintained, particularly for individuals and groups who have no voice or role in the collection's creation. End quote. And then Jane asks, could the donor be using it as an opportunity to get back at the boyfriend? Her writing indicated she was upset and hurt by his actions. Did we even know if this was the truth? And what is our responsibility in regards to digital privacy? In the past, we had redacted personal data like social security numbers from documents before putting them in the repository. Was this a similar situation? Should we deal with sensitive material differently when it is being made freely available online versus restricted in the physical archives? And then Jane wrote, it is more common, acceptable, and sometimes necessary in the digital library context to curate digital collections and make decisions about what to include. For example, excluding duplicates, poor quality files, or materials that are too fragile to digitize, rather than put a collection up in its entirety. So that was Jane's thinking and reasoning, which I agree with some of the points, but here's what I thought. So first and foremost, I thought we should provide access to this because the information was not confidential. It was sensitive, and there is a big difference, right? We legally can't put confidential information like someone's social security numbers or health record online, but details about an affair are another story. And I kind of have this ingrained belief that it's not the archivist's job to decide what constitutes too sensitive, and the archivists shouldn't restrict information on this basis alone. And this really comes from working at the University of Wyoming's American Heritage Center with Mark Green for the first 7 years of my career. So Green really pushed that quote, both that the risk of the repository being party to a privacy suit under such circumstances are very small, and that we have no firm ethical grounds upon which to restrict material that a donor does not want restricted, end quote. I would agree to that. I would also add, who are we to judge what is socially acceptable and unacceptable, especially when knowing that this is a moving target over time. And I really default to providing access over restricting materials. Additionally, the boyfriend's name doesn't appear in the document or the oral history or anywhere else in the materials that she donated, because she deliberately removed or left out names. Now, if his name had appeared in the document, then we would have to restrict access because it is specified in the gift agreement that the names need to be redacted. And so we wouldn't have done that, and we would have had to restrict it or return it to her. But regardless of the name issue, the risk of a lawsuit is pretty low. So currently the collection is probably not getting much use just based on our research trends, what our patrons want to see. So if the boyfriend discovers the information, he would have to take some action, which would most likely be a written complaint to us at the university or the university. And at that point, we could take it down. But for this to actually progress into a lawsuit would be unlikely. And then there was a part of me that wanted to expose this guy for cheating on our donor. If this guy really did everything that she said he had done, then he deserves a little embarrassment. And I know that that is not professional, but part of me wanted to expose him. Okay. So let me ask you, after knowing that, what would you do? Would you make this written account accessible online? Why or why not? I'll check my time. Okay. And you can answer in the chat. Sounds like the donor didn't ask for any. That's correct. The donor said, put it online. So yes, you would make it accessible. And I'm imagining everybody else is trying to work through what to do. I mean, we were kind of stumped, especially because we were on such opposite sides of the issue. All right, well, we'll see if anyone else chimes in. And so yes, it seems a reasonable risk given the redaction. Okay. Yeah, with removal of PII, we have a similar situation with diary journal entry submissions in our COVID-19 collection. Okay, so what did we do? Well, we decided actually to not make it public in digital UNC. We were worried about backlash. You know, we were worried that the boyfriend might contact the library's administration, or worse, senior level university administration, which would undo any goodwill and value creation that I was hoping for at the beginning of the project. Also, it was just such recent history. You know, perhaps in 5 years, we can make it accessible along with the rest of the collection. Maybe in 5 years, the boyfriend's name won't appear on her social media pages, and you know, maybe they'll break up. He'll be long gone, but maybe it won't be as discoverable as it is right now. And you know, I know that restriction of an entire document is not ideal. It's perhaps less ideal than redacting, but this particular donor's experience is documented in her oral history. She does mention her boyfriend cheated on her within her oral history. It just didn't go into as much detail as the written account. And those are all online now. So the experience is documented, and it's available without the written account. So because we had little physical or an intellectual control over the materials in general from going straight to access, I was worried about this document becoming lost in this decision, because everything else that she gave us had been donated or had been uploaded to digital UNC, except for this one thing. So it'd be very easy to forget about, especially given our poor born digital collections management practices. But to handle that issue, we actually did upload it to the repository, but it's a suppressed record. And so it's inaccessible to patrons, but staff that are looking at this collection from the staff side are going to be able to see that there is a suppressed document and not forget about it. And then I also made a note in our collections management database regarding the decision. All right, so what did we learn? Well, you know, if I had to do this again, I would not have cut out accessioning and processing. This was a useful lesson in why it's important to process materials, or at least gain some control of the material before serving it online to the public. And I would have made a more robust plan. I kind of had an outline plan that, but it was a very bare bones plan, but so I would have made a more robust plan with major phases, who was going to do what, and that would have included an appraisal step. Now that said, most of the content that we acquired didn't pose a problem. And if it hadn't been for this one document with details of an affair, then I'd be more inclined to cut out some of those essential collections management actions that I know and love. So for the future, you know, we will likely address similar issues as we start putting more whole collections online and more born digital materials online. Archival collections, they, you know, as you all know, they document the good and the bad. They contain issues and situations that not everybody is comfortable with. And I don't want to go down the road of sanitizing the archive just because it's in the digital repository and it seems inappropriate, right? So really, we know we need a policy on sensitive materials and third-party privacy, and we have yet to create that, but at least we know that we need that. So that is all. It's 10:30. So if there are one or two questions, I'd be happy to take them before passing it over to our colleagues at LYRASIS. And if you have any questions or want to follow up with anything, you can feel free to email me. And we can also do questions at the, let's see, did the donor have any comment? Okay, that's a great question. Did the donor have any comment about your decision? So we actually did not tell the donor about this, which that was something else that I thought about. Should we have consulted with the donor about what to do? Should we have consulted or got permission from the boyfriend? Should we have asked him, hey, are you okay with this being online? We just kind of made the decision, and she hasn't noticed that it's not a part of the collection on Digital UNC. I don't know if that's because there's so much stuff from her on Digital UNC, or if she hasn't looked at it or what. But yeah, that's a really great question. So we did not consult the donor or tell her that this document isn't part of the online collection. And then Dylan says, I appreciate your willingness to take the risk of collecting in real time and developing policies and procedures as issues come up. Thank you. For Digital UNC, will you provide the link? Oh, that's a great, yes, I will as soon as I am out of my slide share. Thank you. What is your sense of the overall historical value? Whoops. Of the materials you collected? We are contemplating different ways of soliciting materials about COVID, but one of our biggest concerns is how to avoid needing to sift through many materials that don't seem as historically valuable. Most of what we got, I think, is actually good stuff. And so I do think it is valuable. It is good. It is good documentation of the pandemic, of our, students and faculty's experiences. Yeah, but that, appraisal is a good question, right? You don't want to just take anything and everything that people give you. I think that if people had started giving us newspaper clippings, secondary material, things like that, which often happens, then we would probably, I would hope that we would tell them that we were not going to take it, just because it's that material is available elsewhere. Okay, I'll just answer Ruth's question and then we'll move on. Can people look at the donor's written account in the research room, or is it? Yeah, so we haven't decided that yet. And right now that document is so hidden from researchers, like it's not inventoried in the finding aid. So right now researchers wouldn't even know to ask for it. But that is something that we talked about, and I think, I would be on the side to definitely make it available in the reading room. But we would first have to process the collection. All right, well, thank you so much for listening, and I will pass it on to LYRASIS.
Thank you, Laura. That was great. Really, really interesting. I loved it. And great questions too. So my name is Lee Grinstead, and I'm going to start us off. First of all, I just want to thank you all so much for joining us here today. My colleagues and I are going to take turns presenting, so you'll meet Katie and Tom in just a moment. And I hope that you're going to find this just as interesting as we have. In early April 2020, LYRASIS had an institution reach out to the consulting team for advice on how to safely collect archival materials during that early stage of the pandemic. And this archives had already held a substantial collection from a donor whom they had just learned had contracted COVID-19 and had passed away. On hearing the news, the archives learned that they had 1 month to collect the remaining materials from the executor before they were lost. The archivist suspected the donor had not been in contact with the materials for at least 30 days, but the executive director was concerned about staff safety since at that time, little was known about how the virus was transmitted or how long it remained active on surfaces and materials. So we advised the collection be sent off to an off-site storage location until more research was conducted, and we sent them the CDC guidelines. But that consulting request was the impetus for us to develop a survey to uncover collecting trends and determine archival practice during the pandemic. Our primary goal was to really provide guidelines for staff on how to safely collect archival materials. However, the survey revealed other potential risks to collections that appeared as a result of limited physical access to collection storage areas and a move to remote staffing. So these topics and more have been published on our website, and I'll put the link in the chat so that you can read the full report here. And okay, next slide, Katie. Great, thank you. And I'm moving between two slide screens. So the total number of archives who responded to our survey were 268. The breakdown by institutional type is interesting because it seems to cover the archives field well, and we were really, really pleased with that. In round numbers, we had community colleges representing 1.5%, governmental archives 7%, historical societies with archives at 12%, and museum archives at 13%. Private colleges and university archives are the second largest group at 24%, and public libraries at about 6%. The largest group who responded were state colleges and university archives at almost 27%, and special libraries represent approximately 9%. From my perspective, having historical societies and museums representing 25% of the overall responses is encouraging in that that is an audience that LYRASIS has been working to reach out to over the past few years. 98% of those who answered our survey had direct responsibility for overseeing the collecting of physical and digital materials. And you go to the next slide. So 47 states are represented. Only Hawaii, Louisiana, and Wyoming were missing. Okay, Katie, next one. So 67% of respondents said they had difficulties in physically accessing collections between March and June. Only 1/3 said that they actually had no difficulty at all. Even though we only asked for a yes/no response, we did get additional information and some trends to note. Almost half said that no one had access to their collections for an extended period of time. 4% said only facility staff had access, and slightly more than 20% said that only administration or the head of the department had access, and the same for archive staff who have access in shifts. So you can see the level of concern this generated for archivists by reading some of the quotes we received. I've not been allowed into the building since the middle of March, and we were ordered home. This is an ongoing issue we're working to resolve, but no resolution is in sight. We had no access to any physical collections from March 18th to June 8th, 2020. Very upsetting to be able to care for the collection, not to be able to care for the collection, especially when we're out of the building. And the dean of the libraries has access to the archives, but did not need to go in while we were physically closed. Okay, next slide, Katie. Thank you. And I'm going to turn this over to my colleague, Tom.
Hi, everyone, and thank you, Lee. We actually expected that a lot fewer institutions would be collecting physical materials, considering the fact that 67% of them, as Lee had been saying, were having access challenges getting into their building. But about half of those surveyed said they were continuing to collect physical materials. And we asked about a lot of factors that were influencing collecting. Collecting preference by format, safety precautions, collections policies, and resources for safety. And the most interesting thing was, and certainly we felt that this might be true, was that upholding their institutional mission was by far the biggest reason that archival organizations continued collecting. A number had or were planning to create a policy for collecting during the pandemic, but this again was so early that a number of organizations had not. We'll talk about some of these other areas in our next few slides. And if we could go to the next one, Katie. When people were asked about the factors influencing their decision to collect, you can see that some people were afraid that if they didn't, they would lose out on materials, as people were using their stay-at-home time to clean out their homes of potentially important materials. And certainly I have made Lee and Katie groan in earlier presentations that we've done where I've said, yeah, I was doing that during part of the pandemic. So I think that this was a smart plan for people to have as a policy. And you can see that at least one institution admitted to feeling political pressure. When the university president calls, you respond. And the president resigned after that. But certainly there were some interesting things that were going on that were causing people to think about continuing to collect their physical materials. And you'll hear later from Katie some of the ways that this was happening. Next slide, please. When we asked what special precautions are you taking to protect staff and users from risks related to donated materials, the most popular precaution was quarantining materials. But at this time, the guidelines were not out. And so people were saying for many days or for 72 hours, for months, and a variety of other time periods. The second most important and popular answer was wearing masks and gloves while working with the materials. The third was social distancing and having only one assigned staff person at the archive at a time. And one of the things that we were very interested by was that 4 respondents said, we don't really care about protocols at all. And you'll see some more about that as we go through some of our other answers. One person responded that their main concern was that intake was encouraging person-to-person contact with others that wasn't really necessary. And that had more likelihood of unnecessary contact in close proximity and with physical labor being done. So curatorials activities with donors, curatorial activities with conservators, and all of those things seem to be a threat to this person who had a concern about close proximity and lack of social distancing. The most common response about quarantining brought out many comments, and looking back, it's interesting to see that variety and the lack of consistency that archivists had and that we were operating within. And these 2 quotes are really interesting. I'm not fearful that I will contract COVID-19 from donated materials. We're so understaffed and closed, the materials could sit for a year without being touched. So in some ways, it was quarantining by, not by design, but quarantining by what was happening with the workflow. And then we're not open to the public currently, so I'm not concerned about user exposure to donated materials. For staff, we'll receive the materials and let them sit for a few days to eliminate any chance of virus exposure. So on the next slide, when we asked, have you consulted other resources for how to safely collect materials, we were surprised that 50% of those still collecting physical materials referenced no resources on safe collecting processes. We think that at this point, it would be really interesting to pull their individual answers to see how long they quarantined collections for. We thought the data reflected a need for standards and recommendations within the field. And at this time, we were collecting and no results had been published from the Realm survey, from OCLC, Battelle, and the American Institute for Conservation, but there were starting to be some articles and general recommendations even early on. But we saw this as an opportunity to create resources for our members at LYRASIS and for archivists nationwide to be able to consult. So I'm going to pass things back over to Lee to see what directions we started to go with some of these policies.
Yeah, thanks, Tom. So those that did look at resources mentioned the following. Various internet sources regarding how long the contagions can live on physical objects. Some people mentioned the New York Times. They said reliable government websites and university documents. They also said they couldn't remember. So some people simply could not remember what they were looking at. And then one participant noted the local Seattle Heritage emergency responders had put information out there. And so they called them out as well. Let's go to the next slide, Katie. So slightly more than half of the population surveyed did not collect physical materials during this time. We also asked specifically if policies and standards were created by an external organization or an agency for accepting materials that were potentially exposed to COVID-19. Would your institution feel more prepared to collect those materials? And 72% said that those who were not collecting materials would in fact like guidelines. That confirmed for us that using the resources and information from Realm was really going to be critical moving forward. Okay. When we asked what factors contributed to not collecting, institutional closure was the number one choice, with almost 88% answering that way, and staff safety at just under 63%. Other responses included relocating or renovating the archives, a lack of staff, or the safety of donors. And 97% of those surveyed agreed with the decision that their institution had made to stop collecting during this period. We included a question in the survey to determine if there were materials that institutions would be more comfortable collecting based on material type, and 62% said no. This was a question that I was keenly interested in. I thought perhaps the pandemic might push some institutions into digital collecting, perhaps for the first time, sort of as Laura said earlier. Not that it was the first time for them, but the first time for that kind of initiative. It turns out that 83% of those who were still collecting were already including digital materials in their collections. You can see here that we asked questions about what factors influence their collecting practices, preservation strategies they had in place, and if their collecting policies changed. And that same 83% said no to that. We were also curious to see if institutions developed pandemic collecting policies, specific pandemic collecting policies, and 33% said yes, they had. We also touched on whether they had a collecting preference based on format type, and if this was an expansion of their collecting practice, and 86% said they had not expanded their collecting practices based on format. Again, I expected perhaps we would see an increase in born digital collecting, but I think you'll see some of the rationale for that later on in the presentation. And Tom, back to you.
Yes. And, one of the things that I felt was very interesting about this survey was we certainly got good data from the respondents, but we also got some really interesting quotes that help us tell some stories and help tell the stories of collecting policies, collecting activities during the session. So we've pulled a few quotes, and I'm going to highlight some of what you'll see. And these, again, do stay pretty closely to some of the things that Laura talked about in her presentation. So this quote: "We've been collecting digital materials before the pandemic. This will be the first time we will be collecting materials as current events are happening, and with the pandemic, the first time we're truly taking a break from analog and paper materials in exchange for born digital items." So this was the kind of thing that I think Lee and I and Katie expected to be happening at a lot of places where they might sort of flip the switch to digital collecting. So that certainly was an interesting direction to go. And then on the next slide, we have some additional important quotes. I think that you know, we see that one organization actually advertised to seek digital submissions about the pandemic. They'd never advertised for collections before. We're collecting digitally because these items are often born digital and because it's easy for people to donate digitally, which many of you may have also had experience with. For collecting pandemic related materials, we implemented a form using Qualtrics. So this was at a university that had a Qualtrics system already going. And this was a fairly easy workflow. Donors filling out the form, including the files, and submitting the survey. And then the staff is notified, save the receipt, email, survey, and files as a package on their servers. And our final quote here is, we found that there wasn't much information from our institution during the flu of 1918, so we wanted to make sure that future researchers would know exactly what happened during COVID-19, the good, the bad, and the ugly. Really, we heard throughout many of the comments and much of the response to this survey that a number of archivists saw that there was a real gap in their archives in information about the flu of 1918. And this quote illustrates the issue for some collections. These are archivists who did not want to see a gap like this facing future researchers. So we'll go back to Lee for some more on
Yeah,
digital preservation.
I thought that last quote was especially interesting. Yeah. We were in the process of advocating for better infrastructure to support digital collections before, and the pandemic has served as a great opportunity to highlight why this infrastructure was and is important. This period presented an opportunity to keep the campus community connected and take advantage of the availability of IT staff to collaborate on a collection method. We had been wanting to engage in similar projects for quite some time, but the global urgency of current events created the buy-in across our libraries to support such an effort. We're collecting small amounts of digital material, but are not in a position to do anything with this material until we return to campus and have full access to the preservation server again. We have accessioned material and it's being stored temporarily either in our local shared drive via remote desktop access or via Google Drive, and then nothing until we return to campus. So one quote that I didn't pull, but I liked was, our digital materials are not a significant part of our collection. However, the questions on this survey prompts us to consider a policy on their collection and preservation, which just was music to my ears as a former curator. I have to say that. I work at a small private university where we have many small private colleges. We're all going to be extremely financially stressed for the next 5 years. Some of us are not going to survive. Survival at this point is likely to make my difficult job, even more challenging. Because of the economic impact of the pandemic, we will no longer be subscribing to a preservation repository as initially planned and approved in this year's budget. So I end with this in terms of quotes, which is perhaps one of the most stark because it has implications for our field at large. They do identify as a smaller institution, but this will likely have ripple effects and the kind of effects that we've been thinking about and talking about strategically in our consulting group for a while. Tom and I were lucky enough to work for the National Historic Preservation Records Commission on a grant around small and diverse archives. And that report is also on our website. It has a lot of information about the potential economic impacts and solutions and concepts and ideas about how, as the field, we may come through this in a more healthy way. And we may be able to, we'll try to put the link to that report in the chat later on.
Okay,
Thank you.
thanks, Lee. And I'm going to talk just a little bit about some of the respondents who decided to not collect digitized materials during the pandemic. We'll talk about some of those influencing factors to not collect them. But I wanted to point out here how many organizations said that they would feel comfortable collecting digital materials once again as their building reopens. You can see that that is by far in the right-hand corner, bottom corner, the area where most people responded. And as we draw closer to hopefully reopening, some in the summer session, some in fall semester, some for at public and special libraries and archives, with some openings in June, July, etc. That may be a time when we can move forward in some of this digital collection. Next slide. The interesting thing here is that there were a number of factors, some matching what we saw about physical collections, but others that were completely specific to digital as far as the factors that contribute to the decision not to collect digitized materials. And I think the biggest one here is lack of infrastructure to be able to do this. Lack of infrastructure, and in some cases, lack of policies, certainly a lack of staffing and budget constraints, all were areas that contributed to the decision to not collect those materials. So another interesting finding. And back to Lee to talk about some of the resource documents that we created.
Yeah, so we created a number of resource documents that can be shared with the community based on the report findings. We weren't able to provide resource documents for every need, but for most of them we were. And the needs identified included space planning, reopening policies, collection management and handling recommendations, digital preservation training and resources, advocacy for collections management work. So what collections care actually means, and you can't really shut a building and walk away without some potential threat. Digital preservation policies, training and infrastructure, and some preservation planning. So where disaster response may be needed because people closed the buildings and walked away, right?
Yes, and on our next slide, we've come up with some key ideas in disaster planning for the pandemic and beyond. And this is an interesting area for me because I've taught about this for a number of years. And a lot of my discussions with archivists, librarians, museum professionals focus on working with our collections and our materials. But I really do think that we need to focus now and in the future on health and human safety issues first in any case. I work, about half my job is working with performing arts organizations. I run a project called Performing Arts Readiness. And the one thing that we saw from them that was very interesting and people started to think about for library and archival institutions was the idea of continuity of operations planning. If our organization is closed to having people physically come in and work with us, what can we do as far as digital reference, virtual reference? How can we make sure our operations and our services can continue? Getting to know specialists in the field, disaster recovery vendors, cleaning companies, and even heating, ventilation, and air conditioning engineers are going to be very important to have. The disaster recovery vendors, it was astounding to me last summer how many galleries and small museums I talked to that said, oh, we had water leaks and people weren't coming in besides once a week. And so there was 6 days of water flow through one of our collections areas. So they needed to know those disaster recovery vendors. They wanted to know the cleaning companies who could clean their public areas. And for longer term, everybody, I think, wants to know who can work with their HVAC and think about better airflow. Policy development. We did see many organizations utilizing the time when their facility was closed to develop some policies about what could they do to both jump back in when their organizations opened again and what they could do in the future. So reopening and safety protocols were a real focus of many organizations. And they also said, well, this is a big disaster. I'm outside of my building, but we've had small fires. We've had boiler room problems and leaks before. So we're going to put together an emergency preparedness or disaster recovery plan as well. And another thing that we saw people moving toward, and this has been a growing area, is that you don't have to do this alone. Collaboration is definitely key. I know that some of you, many of you may be in the New Orleans area, and there is the New Orleans Preservation Council and New Orleans Alliance for Response in that area. Certainly in Texas, there's Texera, the Texas Collaborative Group for Emergency Response. And so think about talking with some of your peers and some other organizations about what they did both during the pandemic and what their plans are for disasters in general. And the last thing here is that LYRASIS can assist with your planning. Katie and Lee and I, and there are even some other people that we've recruited from other parts of our organization, oftentimes get people's disaster plans for review, and they say, what's missing? They say, we feel like this might be a little bit of a Swiss cheese plan that has some holes in it. Can you take a look at this plan and talk about other risks and threats that we should look at, other types of vendors we should have in there? And we are glad to do that. And that is something that we do free of charge. So really, in addition for planning for the pandemic and opening, we thought about some more holistic disaster planning. And now I'm going to turn things over to Katie to talk about some other areas we develop policies in and other findings that she's had.
Great. Thank you so much, Tom. I really appreciate it. And hello, everyone. My name is Katie Clettlinger, and I am the newest member of the consulting team. I did want to apologize that I don't have video on today. When we initially did the testing, it turns out I had the lag. I actually reside in Ohio, so I always blame my state. So I do apologize for that. But the good news is I do have a picture there. So in talking about the resource documents, a large trend throughout the survey was how to adjust to working from home when we as archivists have always been used to working directly with our collections at our records locations. Some survey respondents were creative in their approach by deciding to digitize or process collections at home, while others decided to explore the possibilities of new projects. So one of the resources that we created that can aid in polishing skills and pursuing new projects is our education platform, LYRASIS Learning. So the LYRASIS Learning team actually made a resource document handout specifically towards transitioning from in-person to remote. So it actually does have a good number of list of ideas on what you can do to make that transition easier. Something about LYRASIS Learning that is unique is that it has over 75 classes focused to the archival community. So that's something that can be very advantageous for when you're pursuing new projects, thinking about ideas, or maybe if you have someone on your staff who's going into project management for the first time. If you ever have any questions about LYRASIS Learning, feel free to contact us. Our team is always happy to lend an ear and provide suggestions for program building and continuing everyday operations. So part of my job, in addition to being a consultant, is an outreach librarian where we work with all of our members directly. And these are the kinds of services that we offer. So always feel free to reach out to us. We're always happy to help. And then, another area we decided to make a resource document on was definitely space planning, because reference services amidst the pandemic was a popular concern. Studies from the Realm Project provided some guidance to us, but archival reference involves researchers delving into collections and working with them for long periods of time, which increases exposure for the archivist as well as the researcher. With archives in mind, this report or document resource sheet is a tip sheet with ideal and transitional solutions for setting up archival spaces for public use. Topics in the document range from social distancing to cleaning furniture, as well as how did you have hands-free devices that will allow for less contamination. Lee will now share information regarding the discoveries we made during digital preservation?
Yeah, thanks, Katie. We often define digital preservation as the accurate rendering of authenticated content over time. It's a topic that's generated a large body of research, publications, and professional development training. The goal of this resource document is to entice the reader into learning more about the subject, to ask a few critical questions, and to think about where an institution might prioritize next steps for improved long-term access to digital collections. We provide an outline of questions to launch conversations at institutions around digital preservation planning, practices, and activities, looking at administration and governance, resources, policies, workflows, and technology resources. Obviously, the creation of a digital preservation policies and a digital preservation plan that's tailored for your unique institution and is appropriate for your needs will vary greatly based on your institutional circumstances. There really is no one size fits all approach. And I think we should just acknowledge that.
So everyone, I have good news. We have survived the pandemic for the most part, and things are starting to turn around. Despite the challenges that we've all gone through, the brunt of the pandemic, it's done. We're hopefully much better and in one piece. So clearly this event has transformed our profession as well as ourselves. But what have we learned and where are we now 1 year later? To find out, we did some follow-up interviews with 3 different types of archival institutions of varying sizes who have also completed our initial survey to learn their stories and needs in depth. And the following is what we learned from those institutions. During our interviews that were conducted in February and March of this year, we had conversations with colleagues from 3 different types of archival institutions across the country to discover their successes during the pandemic and the current challenges that they are still facing. Some of the challenges discovered in the initial survey report were addressed, while others were not. For the most part, the challenges that are being faced by these archives were challenges they had before the pandemic had even began. However, in a few situations, the pandemic brought a new awareness to administration and upper management. The pandemic, while a hindrance to our operations, also inadvertently had acted as an advocacy tool for us. So let's begin with the first challenge that archives identified when the pandemic began: access to their building. While most institutions were closed to staff for several months, during our interviews, we found out that access to collections and buildings was starting to turn around 1 year later. 2 of the 3 archives had implemented hybrid work schedules for staff, which allowed for social distancing. One archive allowed staff to even come in and work on Saturdays, which is very advantageous for those who have children or handling other childcare or guardianship responsibilities at home. The public library archives we interviewed was open over the summer and then had to close again due to the surge in virus transmission rates locally. All the archive staff there were still working from home full time when we interviewed them earlier this year. 2 archives decided to be open by appointment only. All other remote reference only. That's something they all did despite being open to the public before the pandemic began. The respondents said that it took more time to complete reference requests, but staff were relieved and safe by having remote reference. So remember when the pandemic started and the majority of respondents said they couldn't access their collections to ensure that they were physically safe because they couldn't get access to their building. Our interviewed colleagues also had the same problem. Luckily for them, their collections were okay. The local government and public library could get into their collections easily. And they discovered they were okay because they had environmental monitoring in place that allowed for oversight remotely. Also, county engineers helped oversee the collections environment on behalf of the local government archive. The state university archives allowed their director to check the collection physically. And thank goodness the director was able to do that because the campus had shut down the library HVAC as a part of a campus-wide strategy to lower energy cost. Obviously, the archival collections were not considered in that decision. The director was able to detect the problem and negotiate with library administration and their facilities department on what was acceptable for the collections and to ensure that no damage to them occurred. Next, we think about safety measures. For the 3 institutions interviewed, cleaning was not as much of a challenge as many thought it would be, thanks to partly the realm study that was carried out. The public library created a rigorous cleaning plan. The county archives had plexiglass put in place for appointments, and staff worked from home for most part at all the institutions. The university was closed to the public and only allowed 1 staff person on a floor at a time. And this is something that clearly made cleaning easier for all. We wanted to follow up on the question about policies to see if policies had permanently changed because of the pandemic. Everyone said that it was too early to tell. They are focused on just basic operations at this moment and will know more when they return to the office. However, our consulting team has been actually contacted numerous times by many clients who have expressed an interest in creating policies while institutions have been shut down. Now is an excellent time to consider policy creation before archival full staffs return physically to their institutions. Now, based on the picture, this is clearly the biggest challenge that our participants and interviewees had and something that they're still dealing with. All are struggling with preservation of digital materials. And mostly that was because they didn't have access to their networks while working from home. The first institution interviewed actually said they refused to do any digital archives work at all because the infrastructure just wasn't there. Instead, they chose to focus on physical processing of their materials and used the director's driveway as an actual touch point for exchanging materials with each other. When I asked this question to the second participant, they actually were caught off guard and said, "Oh no, I forgot to download my materials to the server. Thank you for reminding me." So there were some situations where institutions were so caught up in just handling things day to day and one at a time that they weren't even thinking about access and preservation. And the final participant said that they had this problem before and they're still trying to get a suitable dam system. So it is worth noting that this was one of the major challenges before the pandemic, and it's one that we're still dealing with. So in addition to asking about the challenges discovered when the pandemic began, it was also important to take stock of the lessons learned because unique experiences such as this one, they can impact you and you carry those lessons learned with you. So above are some of the professional insights that we actually received. The first one is our intern provided fresh eyes with their questions on operations, which helped us. They created a digital preservation policy for us. So I think that's a really interesting point because having the fresh eyes, especially when you're used to doing the day-to-day operations, it's clearly important and it helps because we're so fine-tuned to naturally just doing what we do that having those fresh eyes and those new perspectives can help us improve our services, especially when we're dealing with a stressful situation such as a pandemic. The second participant actually said that we learned that being at home gave us more time to focus on processing our collections. So by being at home and not working with the public as much as they did before, they learned that they had the ability of processing collections and doing other tasks that they couldn't necessarily pay attention to. And that allows in the end that when they're able to open up again, that access is going to be improved and will allow for more materials to be used. And then the last comment that I received really came down to communication. Being open and honest with staff, even when news is distressing, is key. I really appreciated this one because this institution really learned about the importance of communication and how doing that brings your team together, helps people feel comfortable in an uncomfortable situation, and it keeps everyone informed. So, in addition to asking about professional reflections, I wanted to ask about personal as well, especially because our personal lives always have an impact on our work lives. So, some of the comments that we got were as follows: children made work life balance a challenge. I could definitely personally understand that one, as I actually had two sons myself through the pandemic and was trying to handle working from home, having a career, but then also being a mom. So that was something that people learned to balance and was a challenge for many. Another personal inflection that was received was, we are very fortunate compared to others. And then the other one was, news is not always good news. The situation was scary and overwhelming, and talking was key. So the fact that they were able to talk to each other and be open, is really not just something on a personal level, but helps us professionally as well in many ways. So that was definitely something that was appreciated. And I'm going to pass it over to Tom.
Okay, and thank you, Katie. I think that up-to-date information was great. And we did have one question that I wanted to cover at this point when we did this program for the Council of Intermountain Archivists. They said, are you going to continue to do this research? And I'm not sure we'll continue to do full surveys again, but I do think that we will probably try to do some interviewing again as activities start up, and maybe we continue to do this on a longitudinal basis. The other thing that I wanted to comment on real quickly was Katie's very last point on some of the personal aspects of things. I found that in work that I was doing in the performing arts world and with museums in their community, they said that the communication, especially internally, was the area where they saw really some of the worst problems in their organizations. So trying to open up those communications channels as much as possible, whether it's by email, whether it's by having, maybe a few more Zoom meetings if we have to, just so people know what's going on. I know that we don't want those on our schedule, but in some cases, I think it's fairly necessary. And so as we close, we're hoping that you might have some questions, comments, or thoughts that you'd like to share, and wanted to see if you have anything that you would want to put in the chat question-wise. And these can be questions for Lee, Katie, or myself, but also further questions for Laura as well.
Absolutely. Yeah. Thanks, Tom. We've stunned you with charts and statistics. We found them fascinating. Hopefully you did not all fall asleep. Oh. So, yeah, we've got one very interesting. We're an outlier in this situation. We were ordered to work since we're a repository for a health sciences university. Interesting. Thankfully, we have the space allowed for social distancing and other public health recommendations. Our office thought that we would be furloughed. What a great presentation and data shared. Oh, good. Thank you. Oh, and you're welcome. Yes, for those of you who may have been following along, we did share the link to those two reports, both the NHPRC report, but also the pandemic report as well. And you can copy those directly out of the chat. Yeah.
And one question that I'd like to pose to the group is that we have developed a number of resources. We brought up the Realm project a number of times during the presentation, where they have developed some ongoing resources and research. But what other activities and what other policies, reporting areas might you be interested in? That would be one thing to think of. We have a comment here from Zach. Were there survey responses regarding bringing collections home to process? No, actually, when we first did the survey, we did not have people talking about bringing collections home to process really at all at that time. And we mainly found those, I think, when Katie was doing her interviews. And I think, though, that we will include that and maybe try to explore that more if we have a chance to do any other research. Lee.
Yeah, and Tom, I did actually have an LYRASIS had office hours, which were sort of open Zoom calls for the community in the beginning about topics like working from home and some other things. I did have a couple of archivists in that one of those that were talking about bringing collections home and processing them at that time. And we did have a conversation about the risks associated with that, just taking materials out of your institutional environment. How do you track that information from a collections management standpoint more than anything else? And people were just using their collections management software to sort of note that the materials were offsite. Um, Not a lot, but I had one or two people talk about that.
Mhm. And I think with previous disasters that were not as widespread, where I've heard from people, there was a lot of concern when people took materials offsite about chain of custody issues.
Yeah,
But I think that there was a little bit more relaxing
yeah,
here. And Zach, that's a really interesting topic and one that we may try to research on. But
yeah.
it would be a good SSA 2022 topic. Yes, going to be
Gonna
a
be a
publication.
publication,
Sure.
gonna be a report. Yes, sir. Absolutely.
And
Um, yeah,
yeah,
Tom, go ahead.
I,
Sorry.
I was going to mention Ed's comment as well,
Yeah,
collecting information on the technology used to address remote work. Um, Mostly, we heard complaints about the technology that
yeah,
people had to do the work at home, that they had limited bandwidth, that their workstations at work were much better, and their scanners and digital cameras were better as well. So even though they were able to do some more processing, there were some things like digitization and other parts of their workflow that I feel suffered a bit. And that
yeah.
was mainly more in comments than direct questions.
I would agree, Tom, and I would say that that was probably one of the things that came up the most was that the technology at the office was focused very, um, let's say campus wide, or they had access maybe to servers and that sort of thing, but remote access to office workstations was non-existent prior to this.
Mhm.
So that may be something, and I'm interested in pursuing this a little bit more in terms of research. That may be something that is changing or shifting, that allowing people to have access or making those connections between home and office may become stronger because of this, but bandwidth has been a real issue for a lot of institutions. Yeah. We heard that on the NHPRC report, I think a little bit more than we did in the pandemic report. Um,
Mhm.
but that was focused on small archives. And so, but I think that's been an issue that's been uncovered, that equality, equity, and access is just not there yet. We're not there yet.
I just saw the message from Zach that he's going to be presenting on Friday, and I may swing back into that session because I'm interested
Oh,
in
yeah.
finding out what will be talked about there. Sharon's comment, my institution didn't collect digital material because we didn't have the resources even before the pandemic,
Right.
let alone
Yep.
during. This ties directly back to what Leah was talking about
Yeah.
with the research that we did for NHPRC. And there's a lot of discussion of our findings, but also Lee wrote some really interesting opinion pieces about directions to go when this kind of situation was happening. And
Yeah.
for that project, we were able to do both a survey and a number of focus groups.
Mhm.
And so we got some really good details from folks as well.
Yeah. So the city of Dallas issued all desk employees a laptop and has upped our remoted access bandwidth. Wonderful. One positive for us. We've been successful during this year, even while closed to the public, which is fantastic. I will say that as a field, people have been extraordinarily creative and working extremely hard to maintain collections, to process collections, to just sort of figure out, bootstrap a way to do the work. One of the larger concerns out of the pandemic survey for me was this digital collecting, as Laura talked a little bit about. They don't have a place to they don't have a preservation server. Most institutions didn't have digital preservation policies to begin with, and they didn't necessarily have access. So we were seeing digital collecting on things like flash drives or through email. And now we have this morass to wade through, and not necessarily the infrastructure in terms of policies and procedures and the technical infrastructure either to deal with this. So that's a gap. That's a collecting gap that's definitely out there. Yeah. Any other questions or anything for Laura? I loved your project, Laura, and I'm wondering if you're going to go back and if you think policies and procedures and sort of digital preservation, do you think that's going to drive a little of your practice coming back in?
Yeah, absolutely. We are already working on a born digital accessioning policy, which there's certain things in there, like where are we going to store things? Not in my OneDrive folder.
Right. Not in Google anymore, right?
Right. Yeah, absolutely. It is. I mean, it's already driving, just more progress on managing born digital materials. But it's a slow process. I mean, I feel like everything in academia and maybe other places, it's slow. I mean, because I want to be, we want to be collaborative and make sure everybody has a say in these policies and our workflows. And, at my institution, it's not just the archive staff that works on archival collections. And actually my colleague Jane that helped with the presentation, she's not even in the archives. She's in the research librarians department. So there's a lot of people to collaborate with and a lot of things to think about. And
you do want buy-in.
Yeah,
you
absolutely.
want buy-in. Absolutely. Yeah. Yeah. Great.
Well, if there are no questions remaining, I want to thank you all so much for your time and your expertise. Please, those of you that are still here, please join me in a round of applause for these wonderful experts. And so coming up on the schedule is lunch for 30 minutes, and then we will have a question and answer period with our poster presentation teams. There were 5 research posters submitted. And if you look at your notifications in the hub, there's a link to the page where they've all submitted an intro video so that you can learn a little bit more about their research before their Q&A. Maybe that's something you can take a look at while you do your lunch at your desk, maybe. So we look forward to seeing you back here at 1 o'clock for our poster presentations. Thank you all very much. Have a wonderful day.